Today we are going to explain about lumbar plexus. The lumbar plexus lies in the posterior part of the subacute substances of the psoas major muscles. It is formed by the ventral remi of the upper four lumbar nerves. The first lumbar nerve receives a contribution for the subcostal nerve, and the fourth lumbar nerve gives a contribution to the lumbosacral trunk, which take part in the formation of the sacral pelvis. When discuss about lumbar plexus, we can find some nerve: iliohypogastric nerve, iliogenual nerve, genitofemoral nerve, lateral femoral cutaneous nerve, femoral nerve, obturator nerve, and lumbosacral trunk. But there have two nerve we can find, but this nerve is not common. First, subcostal nerve and accessory obturator nerve. Iliohypogastric nerve. The iliohypogastric nerve emerges at the lateral borders of the psoas, runs downward and laterally in front of the quadrated lumborum and behind the kidney and column. The transverse abdominis a little above the iliac crest and runs in the abdominal wall. This nerve is a mixed nerve. Cutaneous supply. This nerve cutaneous supply is skin above the pubic and skin over the lateral gluteal, and their motor supply is transverse abdominis and internal oblique. This is a transverse abdominis muscles. Their action is a compressions abdominal content. Internal oblique muscles origin anterior two-thirds of the ilia, and its action is trunk flexion, trunk lateral flexion, and trunk rotation. Ilioinguinal nerve. The ilioinguinal nerve has the same cause as the iliohypogastric nerve, but on a slightly lower level. Iliojuvenile nerve is a mixed nerve. They have cutaneous supply and motor supply. When consider about the cutaneous supply, proximal and medial tie. When consider about the motor supply, transverse abdominis and internal oblique. Genitofemoral nerve. The genitofemoral nerve emerged on the anterior surface of the psoas muscles near its medial borders and run downwards in front of the muscles. Near the deep inguinal ring, it divides into femoral and genital branch. The femoral branch passes through the arteries compartment of the femoral sheath and distribute to the skin of the upper part of the front of the thigh. The genital branch pass the psoas cells and enter the inguinal canal through the deep inguinal ring. In the male, it supplies the cremaster muscles, and the female, it gives sensory branch to the round ligament of the urines and to the skin of the labium majus. This is a cremaster muscles. Its action is a retraction of the testis. Next nerve is a lateral cutaneous nerve of the thigh. The lateral cutaneous nerve of the thigh emerge at the lateral borders of the psoas, run downwards and laterally across the right iliac fossa, over the iliacus and reacted the anterior superior iliac spine. Here it enters the thigh by passing behind the lateral end of the inguinal ligament. Next nerve is a femoral nerve. The femoral nerve emerges at lateral borders of the psoas below the iliac crest and runs downward and slightly lateral in the between the psoas and iliacus. It lies under over the fascia iliacus. It passes deep to the inguinal ligament to enter the thigh lining on the lateral side of the femoral shelf. Before entering the thigh, it supplied the iliacus and pectineus. In thigh, it supplies quadriceps femoris and sartorius. Femoral nerve is a mixed nerve. They have a cutaneous supply and motor supply. When considered about the cutaneous supply, they have a two part. Anterior femoral cutaneous, there is supply anterior lateral cutaneous of the thigh. Other branches is a saphenous nerve. This nerve supply to medial hip joint, medial thigh and medial heel. When considered about the motor supply, iliacus, pectineus, vastus medialis, vastus lateralis, vastus intermedialis, rectus femoris and sartorius. This is a iliacus muscles. Iliacus muscles action is a hip joint, thigh, trunk flexion. This is a pectineus muscles. The pectineus muscles action is a hip joint, thigh flexion, adduction, external rotation and pelvic stabilization. This is a vastus medialis. This is a vastus lateralis. This is a vastus intermedialis. This is a rectus femoris muscles. And this is a sartorius muscles. Sartorius muscles action is flexion, abduction, lateral rotation of the hip and flexion of the knee joint.